Hello, I'm Arlene Stuart and I've undergone multifocal lens exchange. Spire Shawfair Park was built a number of years ago and it's about 10 minutes from where I live in Midlothian. So I knew the hospital was here, but what I didn't know was that Laser Vision Scotland had set up within the hospital, and I found that out by chance when I was speaking to a friend. I've been very lucky. I've had very good eyesight throughout my life until I got to that middle-aged point. Age 45, things started to become apparent that I was going to need assistance with my reading. So I decided to go down the line of getting reading glasses, and I was fine with that. But because of my job, I get up very early in the morning, about 4 a.m. Monday to Friday, and usually I'm doing events quite late at night. So if I use contact lenses, for example, my eyes became so dry, it was a real issue for me. So when I'd heard about multifocal lens exchange, I thought that might be an option. My decision to have treatment at Spire Shawfair Park was a very straightforward, simple one. It was the first time I met the team here at Laser Vision Scotland. They were absolutely fantastic. I immediately felt very comfortable, very confident in their abilities, and what impressed me most was their enthusiasm for what they did and the fact that it was life-changing to every one of their patients. No matter if it's someone who's worn glasses since they were a child, or whether it was someone like me who just needed a little added help when it came to their middle years. It was really interesting hearing about the new procedures and the new techniques. And it was something that I'd heard vaguely about, multifocal lens exchange, but hearing the detail of it is absolutely fascinating. And I immediately felt that this was the right treatment for me. On the days of my surgery, and I had two different surgeries, obviously. The first eye was done and I was brought in, made to feel very welcome, was shown the very nice lounge here, which is incredibly comfortable. I felt as though I was on holiday, if I'm being perfectly honest. And the team were very keen to give me as much information as I needed, and they went through the thorough tests, they checked everything, and I was all suited and booted, ready for surgery. The whole procedure itself didn't take more than, I would say, 20 minutes. And it was an interesting sensation. Nobody likes the thought of having things poked about in your eye, but actually, I quite enjoyed it. The weird thing that I remember in my first surgery was, whilst I was lying there, they had Queen playing in the background, "I Want to Break Free." Bit surreal. But I say two surgeries because what I liked most was knowing that they only did one eye at a time. So they did my dominant eye first, which was my right eye. And then because of my work schedule, we waited 2 weeks until my left eye was done. This is to be sure that everything is going according to plan. And if there's any sort of minor tweaks required, then they can do that before they operate on the second eye. So it is good to know that, because at least you know you're recovering from surgery in one eye, but the other eye is working fine. Although there was a little bit of conflict. One eye just was going, okay, what's going on? There's something happening here. But it was very easy to deal with, I think, after the first couple of days. The second eye, again, a similar scenario, came in for the surgery. I knew the drill this time and really enjoyed the whole experience. Yes, there's a little bit of discomfort, but it's not painful at all. And the team are really good at keeping you relaxed and holding your hand and just getting you through it. They were absolutely brilliant. And of course, not to mention the really nice sandwich and cup of tea at the end of it. It's really good. I would come back for that again. My recovery after the surgery was quite an interesting one. I'd been told that obviously you really shouldn't be driving for a good week after your surgery. And I unfortunately had quite a lot on at that time. So obviously I didn't drive, but I did have people driving me to various events. So it was quite a busy one for me, but actually, apart from a mild itching, which they had explained to me, I had absolutely no side effects whatsoever. And immediately from the first operation on my right eye, I could see perfectly well. And I was quite overwhelmed by it all. The only issue I did have, and I think that's an issue that everybody has between one eye being done and the second eye being done, was a slight variation in depth perception. That was an interesting one, but other than that, it was absolutely fine. The best thing about my treatment is never having to find those blinking reading glasses. I'm like every woman, I have a big handbag, could never find my glasses. I'd have a pair by my bed, I'd have a pair kicking about the house somewhere. Where are my glasses? it was usually the phrase that my family remind me of. And never having to do that again, being able to pick up a book or read a recipe or just read anything without my glasses is just, I can't explain it, it's just the best thing. My advice to anyone else who's considering the surgery is to come and see the team at Laser Vision Scotland. They're so passionate about what they do, and that's what really grabbed me, that they are so excited about this technology and how life-changing it can be for patients. I would say come and see the team, talk through the options that are available to you. And yes, it's a bit of money, but you know, would you rather have a family holiday to America for a fortnight or have perfect vision for the rest of your life?